السلام عليكم ورحمة الله. I'm Dr. Heba Al-Ushahi, lecturer of community medicine at Community Medicine Department. Our topic today is about viral hepatitis. Hepatitis C viral infection. Hepatitis C viral infection. We will start the lecture by a short introduction about hepatitis C. Actually, hepatitis C is the most common parentally transmitted hepatitis. As we remember that the parentally transmitted hepatitis include hepatitis B, hepatitis D, and hepatitis C. Hepatitis C is one of the most common and major cause of parentally transmitted infection. It is one of the major causes of affection of the liver. It is one of the major causes of affection of the liver. Also, it is one of the most common cause of chronic liver disease or chronic hepatitis. So hepatitis C is one of the major causes of parentally transmitted hepatitis as compared to hepatitis B and D, one of the most common causes of chronic liver disease. And we will mention in the lecture that the infection rate or the chronic infection rate is higher than in hepatitis B virus infection, meaning that the clinical manifestations in the acute phase might be milder than hepatitis B, but at the same time the chronicity is much more common as compared to hepatitis B. So I have two forms of patient, either acute hepatitis infection or chronic hepatitis C infection. Regarding the occurrence or the geographical distribution of the disease all over the world, the WHO states that according to researches that the prevalence of hepatitis C is directly related to two important factors. The first is the injection drug use or injection drug abuse, in which we share injection equipments. Injection drug abuse, as they share the contaminated syringe or contaminated injection equipments. Also, the prevalence is related to lack of infection control practices in healthcare settings. So we will find hepatitis C in a country if it has a drug abuse rate, high drug abuse rate with sharing a syringe and instrument, and also there is a poor parenteral practices in healthcare settings or poor infection control practices. So there are two factors associated with the prevalence of hepatitis C in any country. One of the documents from the WHO estimates that around 130 to 170 million people are chronically infected with hepatitis C virus infection, and this represents approximately 2 to 3% of the total population. But actually, the incidence or the prevalence differ from place to another, from country to another. Okay, so we decided that we have two factors that affecting the prevalence, but as an average we have 2 to 3% of the world population affected with chronic hepatitis C. What about the incidence rate? The word incidence rate means the rate of occurrence of new cases in a country. The rate of occurrence in the new cases in the country. We found that the new hepatitis C virus infection reaches up to 1.75 million infection in the world in the year 2015. So in the year 2015, the new cases that become infected with hepatitis C equal 1.75 million new cases, and this represents as a rate 23.7% per 100,000 population. 23.7 per 100,000 population. You are not asked to memorize these figures, but knowing that the overall prevalence of chronic hepatitis C infection ranged from 2 to 3%, and the majority of infected individuals live in Africa and Asia. The majority of infected population live in Africa and Asia. If we revise the color yellow and the color red, we find that the yellow and the red are present in the Asia and in the Africa, okay, in Asia and Africa. Egypt here is one of the countries in which the prevalence of hepatitis C virus infection exceeding 10%, so more than 10% of the population in Egypt have hepatitis C, and unfortunately, and according to the map, Egypt was one of the countries with the highest burden of hepatitis C infection. Egypt was one of the countries with the highest burden of hepatitis C infection. But fortunately, the incidence decreasing and the prevalence decreasing by time, especially with the efforts of elimination program and the mass screening program conducted recently in Egypt, and we will discuss these points at the end of the lecture. So don't forget that Egypt is one of the countries with the highest burden. And also remember that we were having what is called the anti-schistosomal national campaign with parenteral anti-schistosomal therapy during the period from 1950 to 1980. Attribution to the majority of patients in Egypt infected with hepatitis C virus infection, the cause is related to this campaign, as during this therapeutic campaign in which we gave the anti-schistosomal therapy by injection to the patients affected with schistosomiasis in Egypt during the period from 1950 to 1980, improper sterilization of the injection tools or the syringe leading to transmission of hepatitis C in a large scope in Egypt or over a large scale in Egypt, leading to marked increase in the number of affected people with hepatitis C. In Egypt, we conduct what is called Egyptian Demographic Health Survey every several years to estimate the prevalence of certain conditions in the population, assess the maternal and the child health care services, assess the mortality among infants, and so on. So the Egyptian Demographic Health Survey is one of the surveys conducted regularly in Egypt to collect health data about the Egyptian population. We have the last two Egyptian demographic health surveys conducted between 2008 and the last one is 2015. In these surveys, one of the output data from this survey is the prevalence of hepatitis C infection according to RNA, hepatitis C virus RNA, in the Egyptian population aged from 15 to 59 years old. As we see in the figure, the prevalence or the prevalence of hepatitis C positive patients according to 2008 survey was 10%. And fortunately, this prevalence decreased to 7% in 2015. And this figure shows the prevalence of hepatitis C virus infection during 2008 and 2015 in the age period from 15 to 59 years old. The prevalence decreased from 10% to 7% overall. Among women, the prevalence decreased from 8 to 6, and among women, the prevalence decreased from 8% to 6%, and among men, the prevalence decreased from 12% to 9%. So there is a marked improvement and the reduction of in the prevalence of hepatitis C virus infection patients in Egypt. And don't forget that bilharzia infection or schistosomal treatment is one of the major causes behind the high burden of hepatitis C in Egypt.